Hello, I'm Dr. Padmaja Lokireddy. I'm a Haemato Oncology and Transplant Consultant here at Apollo Hospitals Hyderabad. I've been running this program here for quite some time. Joseph is one of my patients. He has come with sickle cell anemia for bone marrow transplant. He has got a sickle cell levels about 80%, and his brother has been a half match, that is 50% match. And when Joseph has come here in his country, he has had hypertransfusions, that is excessive blood transfusions, in order to reduce the sickle hemoglobin levels. And when he came here, his sickle levels were still high, so we put him through red cell exchange, that is giving more blood, taking out his blood and giving a new blood on the machine, on a apheresis machine, thereby reducing his hemoglobin S levels to 30%, below 30% before the transplant. That is one of the key things we have to do in sickle cell transplants in order to prevent complications of rejections and also graft failures. And Joseph had got thorough tests, including a cardiac test, lung test. Most of the things turned out well. Other than his lung functions, when he walked for 6 minutes, his oxygens were coming down. But after the red cell exchange, when we reduced the hemoglobin S levels, his exercise tolerance was good, his oxygens were very well. So we've prepared him for transplant in that way, and his CMV serology is fortunately negative, and his brother is a half match. We have collected peripheral stem cells from him on the machine after giving GCSF for 5 days. He tolerated the procedure very well, and Joseph is now close to about a month after the transplant. He has had a 99% donor in him by the test of chimerisms. He has had enlarged liver, which has turned back to normal size after the transplant. This is an expected result, as we think his liver was enlarged because of extramedullary hematopoiesis, that is, in patients with sickle cell and thalassemia, the blood is produced outside the bone marrow, that could be in the liver and spleen. Hence, we give a normal bone marrow, those liver and spleen should regress back to normal size. So he is well, not needing any transfusions, his hemoglobin S levels are well, and we will be monitoring him for a period of time. So he is close to no complications. Of course, he is only about a month after the transplant. We will be monitoring him closely as an outpatient with a blood test. As you see him, 1 month after the transplant, he is well, playful, and cheerful, isn't it, Joseph?
Yes.
Yeah. Joseph has got a Heckman line for his transplant, which is still in place. We would like to remove it, but he would like to keep it for his blood test. We would soon be removing it in 2 weeks. I'll give it to Joseph to share his experience.
My name is Joseph Chilugusha. I had my transplant a month ago, and now I'm feeling very well because the people here have taken care of me very well. And I just want to thank them for the effort they have put in.
My name is Evans Chirukusha. I'm the father to Joseph Movira Chirukusha, who is a sickle cell anemia patient from Zambia. We came here in December of 2018 for bone marrow transplant. So we came here in December. Upon our arrival, we met the primary consultant, Dr. Padmaja Lokireddy, who's been attending to the patient since then. I must say that the service we've received and the treatment to our son has been very excellent. It has far exceeded our expectation. When we arrived here, we did not know what to expect, but after just a period of 7 days, we realized that we are in very good hands. The team under Dr. Padmaja Lokireddy treated us very well. They cared for us very, very well. Even during the outpatient visits, the inpatient admissions, everything went very well. We had no problem. And most of our fears were allayed because of the way that we were reassured in terms of the treatment. Our son was also very timid and intimidated to begin with, but after going through a lot of assurances and looking at the nature of the treatment that we received, our confidence grew and we no longer feared anything. We were very expectant and very overjoyed because of the way we were being treated. So the excellent service that we received and the outcome of every investigation and a treatment kept on increasing our confidence. So at the stage that we are here, we are more or less like tourists, because the outcome of the treatment is such that our son no longer has any problem and we do not have any anxieties. We can only wish Dr. Padmaja Lokireddy and her team the best of their endeavors. We feel that we cannot even hesitate to recommend anyone to come here. The outcome, our son is no longer having any problems. Initially, during the briefings that we received before each procedure, we were told about the risks and the side effects of the medications. To our surprise, none of the adverse effects or risks were realized. I think all this is because of the planning and preparations that the team undertook before each procedure. I think they were very careful in their approach, to the extent that they anticipated most of the problems and put in place remedial action for potential side effects. The result was that there was no real side effect that disturbed our son. So he was always in a state of comfort, always in a state of expectation, because he had seen from the outset that the care and the treatment that we were receiving were very, very exceptional.